Ladies and gentlemen, dear colleagues, welcome to our panel session. My name is Armin and I have the pleasure to chair this session. Just to briefly introduce myself, I'm working as a senior researcher for the IFZ Inter-University Research Center for Technology, Work and Culture, which is a university NPO hybrid think tank. And over the last 15 or 17 years, I have been concerned with issues of GMO risk assessment and GMO risk correlation, trying to work on both sides of the risk assessment, on the scientific and technical side, but also on the policy side. I have a background in molecular genetics and science and technology policy, trying to cover in both worlds, and I have a special interest in the interface of the policy and the science. So that's my own background. I'm very grateful to Michelle for inviting me to chair this very interesting panel discussion, also to attend this conference. And I'm looking forward to our discussion here. To briefly introduce the main topic and the design of our panel discussion, so the main topic will be post-market monitoring. So as it is one of the main focus of the underlying FP7 project of this conference, but it will have implications and will have outreach into other GMO safety or general GMO safety issues. It will, I hope it will serve to bring together some of the strands of the discussion we had over the last 2 days with respect to post-market monitoring. So thereby we'll have to bring them together, to focus them a bit, and then also to spend some thoughts about possible next steps. So the overall design of the discussions itself will be that we will first have a kind of around discussion among panel members, and then we will have an open session where the discussion will turn to the floor, so where there could be an open discussion. So my job will be to facilitate both aspects of the discussion, and I'm afraid, given the tight schedule, I have to apologize in advance for asking you to be very brief, and for even asking you to come to the point when time is running. So that's the overall design and overall topic of our discussion. To introduce our panel, I think we have an extremely interesting panel here, and there's an extremely large panel as well. So there's no need to introduce each person, I think, because all of them have been speakers here. So just to briefly go through the table here is Gerhard Flachowsky from Germany, Peadar Institute, then to the left is Gerard from the International Rice Institute, Yves Bertheau from INRA, Ashild Krogdahl from the Norwegian School of Veterinary Science in Norway, Helmut Gaugitsch, Environment Agency Austria, and then to my right, Goodman from the University of Nebraska at Lincoln, TJ Higgins, CSIRO, if I pronounce that correctly, in Australia, and Peadar Lawlor, you're from a food, I didn't keep that in mind.
Gaugitsch.
The Irish Food Development
and Agriculture Development
Authority. Thank you. And I'm sorry, could you introduce yourself?
I'm Kristal, Fred Hutchinson Cancer Research Center in Seattle.
Thank you. Okay. I think so. We have an extremely impressive panel, and the panel is not only covering various scientific views and scientific expertise, but we also have a regulatory expertise on board. So that would be extremely important for these who are covering this topic, who have not only expertise on the food domain, but also on the feed and on the environmental domain. So in a way, our discussion will not only focus on food, but will also touch on feed issues. We will bring in some parallels from the environmental monitoring, and might even have an outreach into the novel food discussion, where PMM is also a topic. Okay, let me start the discussion session by reminding you, by two reminders, basically. And one is that we are not talking about these PMM, post-market monitoring, in isolation. Post-marketing monitoring has to be seen against the backdrop of the GM risk assessment itself. So before any GM food feed can be marketed, it must be evaluated following a kind of thorough risk assessment procedure. And this risk assessment procedure has been outlined on the international level by the Codex Alimentarius guidelines of 2003. And these Codex Alimentarius guidelines have been implemented in a way by national context, but also at the level, in our case, at the level of the European Commission. So in all these national and European Commission contexts, we have other guidelines or legislations that are basically implementing and detailing for food feed what is stated by Codex. And to use the word of Codex, the assessment of a whole food or component thereof should be conducted relative to an appropriate conventional counterpart. We have this already. A, taking into account both intended and unintended effects. B, identifying new or altered hazards. And C, identifying changes relevant to human health in key nutrients. So, thinking about these requirements from Codex, one can easily see that this is quite a demanding endeavor to ensure safety. And it's perhaps not surprising that at a certain stage the idea of pre-market, post-market monitoring came into play. So the second reminder is actually a question that I would like to pose to the panel in order to move into the issue now. And that's the question, why actually, and that should remind us of the history, why actually post-market monitoring schemes were being introduced into GM legislation or guidance. So it should remind us a bit and of the history and the thoughts behind. And I would like to ask Helmut if you could comment on that.
Well, thank you, Armin, and I would also like to thank the organizers for inviting me to be part of this panel. Appreciate that very much and try to provide my input to the discussion. Armin, to your crucial question, I would like to respond in two ways. First, I would like to respond to your plea of being short, and second, I would like to respond to the contents of the question. The two things do not easily go together, but I will try to do my best. I think you already mentioned in your introduction that I think that's very important, that monitoring is not to be seen in isolation or in a vacuum, but there is a link to the risk assessment. Yeah? Monitoring and risk assessment are interlinked. They are two sides of the coin, and that would also be my first answer to the question, why has it been introduced? It has been introduced as a result of discussions and implementation of risk assessment in regulatory practice. Now, of course, again, I'm answering this question from a European Union perspective, Austria being a European Union member state. I'm also trying to answer it from my background, which is more on the environmental side, but somehow also knowing about the food safety background. Monitoring is also very important in environmental terms. Why has it been introduced? And in fact, I've been part of the discussions at the EU level for the introduction of the monitoring concept in the relevant EU directives. EU Directive 2001/18, now already 10 years in place. It was introduced because member states felt that there should be something which complements the risk assessment. And monitoring is the response to risk assessment in that way that the risk assessment may include certain levels of uncertainty. The risk assessment also comes up with different conclusions, and the need was felt that there is a system put in place in order to confirm if the conclusions of the risk assessment or if the uncertainties identified in the risk assessment are in fact correct. So some kind of a double check. Was the risk assessor right in his or her assumption? Recognizing that's a challenging task, a scientific exercise, you don't have 100% certainty in scientific issues, etc. And we call that in the EU, and there are different terms available around the world, we call that in the EU case-specific monitoring. So the check of the appropriateness of the risk assessment. And then the European Union and the member states felt that there is an additional need, and that is to look outside in the environment, or in general terms, in broader terms, maybe with a longer time perspective, if anything else may happen, what you probably did not identify already in your risk assessment. Taking into account basic principles of biology and ecology, difficulties of predicting things, etc. So this general monitoring, as it is called in some cases, in the EU it was termed general surveillance, was the second bit of the monitoring concept, so to say, to look for broader issues. I'm maybe not going yet into a discussion on the scientific basis of these two concepts, because there have been also quite some misunderstandings. Case-specific monitoring being the scientific part, hypothesis-driven, etc. General surveillance being not very scientific or not scientific at all. We have heard different types of discussions here. I think the important thing is that both terms are scientific, but they address the issue of monitoring from different perspectives. So, with that, I would like to give it back to you.
Thank you, Helmut, for explaining the context, particularly for the environmental monitoring. You also mentioned this difference between general surveillance and the case-specific monitoring. Well, with respect to GM food feed, there is no such a difference embedded in the guidelines, not explicitly at least. I wonder if any one of you would like to comment on these requirement or for post-market monitoring in the GM food feed guidelines.
There's too much quiet. I think I should do it if nobody else does. Okay. I think that it's an evolving idea. And I think that when I was at the 2001 meeting of Codex that came up with the food safety guidance on allergenicity, and I think that clearly there are people who are uncomfortable with what we know about allergy. There are people uncomfortable about toxicity and things like that. And the idea that you could insert a gene into this 20,000 gene organism and we don't necessarily know exactly where it is and exactly what all genes do makes some people uncomfortable. But the reality is the organisms that are being transformed today, we have generally exceedingly good histories of safety. We have a lot of knowledge about composition. That's all part of the pre-market. So I think that what this was put into and evolved was more when you have a hypothesis that could be addressed. So, and if I could just throw this out and make some people uncomfortable, if you decide you're going to make a nutritionally improved product by inserting an enzyme that would make a different fatty acid, or if you're going to do something like that, then there might be a need for post-market monitoring to do one of two things. One is to assess whether it works or not. The other would be maybe you have made a secondary metabolite that you were not aware of that might have some toxic effect. And the reality is the pre-market assessment usually has demands that will take care of most of that. So I think it's a sort of a nebulous thing. I don't think that there was ever an intent, except maybe in a few scientists' minds, I don't think there was really an intent to do a general post-market monitoring on all GM that would encompass all aspects of food safety, partly because, as Dr. Higgins would tell you better than I can, when we've done breeding, we sometimes have whole genes or whole chromosomes exchanged, or we have breakages induced by radiation or chemical mutagenesis, and in those cases we're not going to extensive post-market monitoring. But maybe that would be a place where Dr. Higgins, if you would, if he's interested, or you would.
I could just add only a few things to that, but just to explain that in conventional breeding, it can be very closely related varieties that are crossed, but sometimes it can be different species, even different genera can be crossed. I mean, triticale, a well-known feed component, is a cross between rye and wheat. Well, that's a fairly major exchange of genetic information compared to what happens in a GM type. So, Rick is right. There is a huge amount of variation that is introduced in conventional breeding that doesn't attract any attention at all. Perhaps it should.
Thank you, DJ. The concept of post-market monitoring is something that cannot be seen in isolation. I mean, it's something that's not only specific for GM food, it has also been picked up in the context of novel foods. In fact, it's part of the regulation, also included in the new draft regulation. So this is broader than the issue of post-market monitoring, is broader than that. And as we know from Armin's presentation, so there is prior experience with post-market monitoring in certain geographical contexts, like the US, at least with one or few examples. So the interesting question here is also to take a closer look about the general context of post-market monitoring and food safety. What experience do we have with post-market monitoring so far in the food safety context more generally? And well, would it be a concept? Can we retrospectively say that the methods and studies that are being used in post-market monitoring would actually are helpful to discover any food safety threats to food safety? So we must have a history of food safety scandals and scares. So I wonder if any one of you could comment on the last three decades of our food safety scandals or scares, and their potential relevance to our concept of food safety post-market monitoring. Okay, Gerard.
Can I not talk about a scare, but talk about something that's happening? There's a lot of post-market monitoring goes on in nutrition, for instance. Countries still survey iodine deficiency levels. They survey the amount of iodine in salt, and for some of the ingredients, they would be making sure the ingestion rate was not approaching the upper limit. So some of these things are part and parcel of how you prove the effectiveness and impact of health and nutrition interventions. But as we get to the next page, these are obviously hypothesis driven. You know exactly what you're looking for, both positive and, if you want to look for the upper limit, as the negative. So these are done, but they're incredibly directed and absolutely necessary in those cases.
And, okay, thank you, Gerard.
If you think about the food scares in the past, they're primarily either contaminants, it could be melamine in milk in China, or purposely added or not purposely added, or they're infectious agents of one type or another. And usually the way these are identified is by they're acute. The effects are acute. They affect enough people, it's unusual enough that it triggers an investigation. And that kind of surveillance system is well established, at least in the US, and I presume in most other well-developed countries. And when unusual diseases manifest themselves in a cluster in time or space, that there are systems to investigate them. The most complex example I can think of is mad cow disease, which took a great deal of time to even figure out what it was, and then to realize that it corresponded to a disease in humans. That took quite a bit of time. But in each case, it's something very, very unusual that triggers an investigation. But the thing that I'm struck by is the idea that you can maintain surveillance for unintended effects. And I have to say that I just don't think you can do it. If they don't fit the criteria of being acute and rapid, then if they affected something as vague as cancer risk or cardiovascular disease risk or diabetes risk, you could never, ever detect it. And so the idea of a blanket ability to look for undetected effects is actually impossible. I just don't see how you do it.
Thanks, Adam. Anyone else? Yeah.
I may add something. It was the last 12, 15 years, not only 30. I agree the most important case was the BSE crisis in the world, especially in Europe. In Europe, we have a white book for food safety, and consequence of this white book, we established the EFSA in 2003. We established a lot of national organizations, and we started to learn programs about post-market monitoring, from my understanding. It was a very important starting point, and also along the food chain. We had during the last 30 years the foot and mouth diseases. It's also such a very important point to follow, and we learned quite a lot. Also the avian diseases, maybe there are some very important things. Another point, maybe we have to look a little bit what happened now with the antibiotics in the animal nutrition and along the food chain. In 2006, antibiotics were stopped as feed additives. And they were given to the veterinarians. Therefore, they are not in the food chain by the feed mills, but the veterinarians, and they were paid for the products. They give it directly to the farmers. And I think this maybe we have some problems in Germany about this here. We have a little bit more careful in this field. What happened with the antibiotics in the food chain? Maybe a classical topic is also the dioxins. We have every 3, 5, or 2 years in so-called scandal, maybe small or bigger ones from different fields. Could be also we collected some experiences to follow, to observe the situation, and maybe also the last crisis, the last problems were finished after 2, 3 months. The first ones we need 1 or 2 years. There are some problems, maybe also some good example what we learn from the so-called dioxin crisis. But this more an elementary aspect from the food chain that belongs to the animals. We have also some other examples, I think so.
I just follow up on that one. The dioxin crisis. There wasn't one in Germany most recently, but the one prior to that was in Ireland. And I suppose the one thing about it was our authorities were monitoring for dioxins in meat. And that led to the early detection of dioxins in pig meat. And whereas it caused what we call a crisis in the country for pig producers, it did away with our markets for a short period of time. It did mean that we were able to identify the problem early and call back product so that bigger problems weren't caused in the marketplace. And within 6 months, we had regained all our markets back again. So maybe that's a positive story from post-market monitoring.
Thank you, Peter. I think from the statement, from recent statements, it can be concluded that over the last, particularly over the last 2 decades, we had a series of incidents, not only scares, you're right, incidents, but also scares and scandals that, in a way, led to a kind of increased perception of the safety issue of food. These incidents eventually led to drastic rearrangements in European food safety regulation and institutional rearrangements, but also helped perhaps to bring along the idea of this post-market monitoring and to use post-market monitoring concepts more into food safety. So let's move now more into the topic of the concept of post-market monitoring. Those of you who have been following the various presentations might have recognized that there are different concepts for monitoring out there. They are more active and hypothesis-driven and less, and there are also ideas about more general surveillance and non-targeted monitoring. So I wonder if we could explain a bit more these different concepts and describe a bit more the differences between these concepts in relationship to food or feed. So I'm not sure who would like to start with. Alan,
it's a pretty simple question, really. So, so the active hypothesis-driven activity is really just it's a well-designed research study that's well executed. You've got a hypothesis, you find a population, you figure out the design, you know what you want to find out. I don't think there's such a thing as an active nontarget generalist analysis. That just doesn't make any sense to me. I don't even know what that those string of words together means, and maybe it translates better in German, I don't know, but it's still. And adverse event reporting is well established where consumers call in and attribute some symptom they're having to something they ate. And I guess, you know, that has yielded some information in the past. It's a good thing to do. But it really can't be definitive. It always, the results of adverse reporting are always just going to trigger a hypothesis-driven research exercise. I don't see any option to that.
Great. Yeah, please.
Yes, I think there are a couple of examples that you could think about a little bit. One of them would be food allergies. So we already know a lot about different food allergens, and Steve Taylor at the Food Allergy Research and Resource Program where I work does a lot of, their lab does a lot of testing to evaluate whether a given unlabeled product, so it's labeled and it's supposed to be labeled in terms of does it contain milk or eggs or peanut or tree nuts that are known allergens. And sometimes there are mistakes that are made or somebody thinks there's a mistake. And what happens in a way, it's not a government-driven thing, but it's the company's process where they have call-in lines. And somebody calls up and said, my kid is peanut allergic, they ate this ice cream, it's not labeled for peanut, they had a reaction, it looks just like it normally does for their allergy, I think you have peanut in this product. And they hopefully have the product name and the lot number and so forth. If they're lucky, they save the sample of that, and if there's a complaint, I mean occasionally there's a fatality. So it's an important deal. And then obviously there are many aspects of that. If it's a fatality, then there's probable legal action. And so you have to have the stuff, you have to show that it's there, that it would be the probable thing that caused the reaction. Often that's very tough. If you look at peanuts, they usually come in chunks, and it's not, eggs and milk are much more dispersed in the food product, and there's something that's more easy to measure in a confident way. But that's one system, so that's an adverse event reporting, not through the government. Then there are adverse reporting things that can happen through the government, and obviously some of those things may operate through county health departments or through the CDC or whatever, and it depends in part on severity and how things go forward. So when we have E. coli bacteria showing up in spinach, then often it gets to the government, and the government scrambles like mad to try and figure out what's the source. Is it really there? Is it strain 0157 that causes severe disease? And can we trace it all the way to the farm? And that often is difficult, and sometimes there are missteps along the way. And if there are bad missteps, if nothing else, you lose product, because suddenly you're banning produce from Mexico, and sometimes incorrectly. So that's one thing. Another thing maybe would be, and maybe Peadar would be better positioned, or Dr. Flachowsky to talk about this, but I know in India there are a lot of farmers' complaints, oh, my sheep are dying, and I think it's because they ate Bollgard cotton that Monsanto introduced, and I think it's cry one is killing my sheep, right? And so that's an active form because they contact the government agency, and then the government has to get involved. And in every case that I'm aware of, it turned out not to be the case. It was bad nutrition, or it was mycotoxins in the food. And those, again, are ways where somebody recognizes something and somebody has to respond and figure it out. So those are two examples, I think, in animals and in humans, where we can try and find something, and the only way to do that is with investigation. You cannot do that through a general active monitoring system.
Excuse me, Richard, one supplement. In the case of cottonseed, I think the most important program is the gossip board. Laying hens, they have green eggs and so, and also in the ruminants. They are not destructive as a gossip board is a problem, not here.
So I just want to say, the model obtains, either you have a hypothesis that's generated from recursive event reporting, you have to investigate it, or you have a hypothesis you set out with to begin with. And I don't think anyone spoke for the idea of active, non-targeted general surveillance. Maybe we can agree as a group that that is not such a good idea. I'd like to hear about that.
Maybe I have something to say here on this specific item, just to add also my voice to the discussion. It is a very challenging subject, and we are struggling with this also in the ad hoc technical expert group, which I introduced to you this morning, and our document, our guidance we are preparing on monitoring. And I think, as it has been said, the active hypothesis-driven approach is very straightforward. It's very clear on scientific basis, etc. Here, I think, and also in the ATEM, we have quite a good agreement on that this is important monitoring, should be followed, this is an important issue which complements the risk assessment, etc. etc. Now, the difficulty comes with the point B here on our list. It says active, non-targeted general surveillance. And also in the ATEC discussions, I understand that it is difficult, but I see the reason why it is suggested as an additional point of monitoring. I think I can also understand why it is an important additional approach in monitoring. I would like to try to explain. I mean, as I'm working in the environment field, maybe also with a few environmental examples which could outline this. We've been discussing that it's difficult to include unintended effects in the monitoring, intended and unintended. In order to add maybe a further level of complexity, I think it's not only, we have different terms here also around, it's not only about intended or unintended, it is even more about predicted and unpredicted. Because you may have unintended effects which you identified in the risk assessment, and therefore would like to follow it in a case-specific monitoring now, active, hypothesis-driven, etc. This is obviously not the issue if it's intended or unintended. More of an issue if it is predicted or not predicted. And this second point here, general surveillance, active, non-targeted or non-hypothesis-driven, is, as the way I see it, more about these unpredicted issues. And I find it quite difficult, at least the experience from the environmental side shows that, say, the unpredicted issues are less important with respect to their effects in the environment than the predicted issues, and therefore we only follow with the monitoring the predicted issues and leave out the unpredicted ones. It may be quite the opposite. And therefore, this second set of monitoring was generated, general surveillance, look outside in the environment if something happens, etc., without any hypothesis yet, in order to identify also, coming from the other side, not from the risk assessment, from the front, but from the other side, what happens in the environment, and trying and have a system in place to backtrack it to, in this case, we are talking about LMOs or GMOs, to a specific GMO. Colony collapse disorder, for example, with respect to bees, which maybe many of you are familiar with. Maybe such an example. It obviously happened, it's not a good thing, it's an effect which we don't want to see. Now, what is the cause of that, or what are the causes of that? And you may know that there were even groups or arguments put around that GMOs are the cause of that. Well, now I think this has been tackled and clearly is not the case, but other causes, pesticides, whatever. This is clearly an issue where you have good reason to go through this other path, from the identified adverse effect in the environment, and try to backtrack it to a specific incident which gave the reason for that. And by backtracking it, you establish a hypothesis. And now you have this hypothesis, and you test the hypothesis if the LMO was the cause of it, in our case here. Or you may test it also with respect to pesticides or other causing agents. And then you again are very much on a scientific track and in a good position to identify the reason for an obviously adverse effect which happened, and then have the position of being able to do something against it. which is a link to the adverse event report. A little bit long, sorry for that, but it's also a complex issue. I try to find the right words for it.
Thank you. I think several others would like to comment on this. In order to make up a little bit of time, I would like to invite two more comments on this, and perhaps you can bring in also the food or feed perspective. I mean, the question is whether also here whether there is some elements of general surveillance needed in terms of food or feed, whether this adverse event reporting is kind of equivalent to the general surveillance of in the environmental side. So perhaps two more comments and then try to move on to other issues. Ashild and Yves.
Okay, thank you. I will underline what you said. And in Norway, we have quite a few surveillance programs, which we try to keep going. It's very important with historical data, going back many tens of years, regarding food intake in Norway, in general groups, and the government wants to terminate this because it's very expensive. But it has proven that it's very important to backtrack when things happen, unexpected, and then you go back. And I think not only in Norway, but many countries have added historical data to see that the trans fatty acids were a problem in regarding cardiovascular diseases. May not be the surveillance programs that identify the problem, but certainly the information in those programs were important for explaining, and now the trans fatty acids are out. So I think it's very important with a combination of targeted investigations and general surveillance. And maybe it should be extended to other items than we have in the programs today.
I will say that there were several confusions at the beginning. General surveillance and case-specific monitoring is about deliberately released products. When you are talking about dioxin, it's a sanitary surveillance general. It's not, and it is mostly traceability efforts. We don't have to mix traceability issues, general surveillance in case of sanitary issues, and deliberate release of products. In the case of general surveillance, for instance, for GMOs, a very interesting report was made by the Chinese colleagues from reeds. Cotton has been growing in China over several millions of hectares, and just using the GM cottons, they reduce the quantity of pesticides, and amino pest myriads developed. And they were not impacting the cotton, but they were impacting millions of hectares around of fruit trees. So this kind of unpredicted, unintended use cannot be managed by the stewardship of the companies, for instance, as it should have been done, for instance, for the palmer amaranth resistance in USA, or the corn rootworm resistance in USA. There are stewardship with refuge zone, which could be and should be managed. But there are always unexpected, unpredictable effects, like a change of agricultural practices, which may impact other producers, like the Chinese case.
Okay, there's one more urgent comment from Al.
The comment is we are talking in different dimensions. So some of us are talking about environmental impacts, some of us are talking about surveillance of food intake. These are all very different activities, and I don't think anyone, I wouldn't disagree that maintaining surveillance of food intake over time is a good thing to do. It's a wonderful thing to do. But it's not going to tell you anything about post-marketing event. It's not going to give you any information related to whether there's an unintended consequence of introducing the food. There's something called the ecological fallacy, which if you've never heard of, it's the reason that television sets are used to be strongly correlated with cardiovascular disease mortality. You can draw a straight line. And just because something happens in the environment, or something happens, or a disease phenomena happens at the same time that a food is introduced, doesn't by no means means that they're related. And you open yourself to having to investigate an essential infinity of things happening, because everything changes over time, and trying to see whether or not a food you introduce is responsible for that. That's the black box that I don't think is helpful. I don't think any amount of normal disease surveillance is going to tell you anything.
Okay, thank you, Alan. And just would like to add that it is part of the cost-benefit analysis we can make from an introduction of innovation in agriculture. For instance, if you take the cotton in China, okay, the quantity of pesticides decrease, but if you take into account the surrounding trees, for which they increase the quantity of pesticides, the cost-benefit is more balanced. So it has been taken into account in the cost-benefit analysis of any innovation, not only GMO.
Okay. I don't want to broaden this particular point, but I think Alan rightly pointed that is the need to differentiate between the environmental side and the food feeds side. And just because in Europe we have this GMO legislation and we have this concept embedded in both parts of the legislation, environment and food feed, does not mean that we're talking about the very same concept. The concept itself, in its basic elements, it is similar, but in practice it would be quite different between monitoring food feed and environment. So, in order to move on with what we have on our list of questions, I would like to go to one question that has been around there since many years of discussion, and that's the question. And we've heard already. I mean, we got some idea from Alan's presentation, from various interventions, from speakers here about what could post-market monitoring look like, what kind of studies are required. And we heard from Alan's presentation and from other interventions that it could be quite enormous efforts would be necessary in certain cases, and the cost could be enormous to do this kind of monitoring exercises. So trying to skip that, what actually now what should be included in such a monitoring. Another question that's actually around for years is, in what particular cases would you consider post-marketing monitoring to be, in particular cases, there should be a requirement for post-market monitoring. So as you know that in the EFSA guidance, this is not a mandatory requirement. It's mentioned there, it's in specific cases you will post-market monitoring. And I wonder to hear what your ideas are about in what cases it would be necessary. Anyone who would like to comment on this? Any particular examples would be welcome.
Let me make a starting point. Coming back to the history of the EFSA, there was a separation between risk assessment and risk management. It was the main idea to establish such an administration. And that means, for my understanding, our discussions in this panel, if we have some problems which we cannot clearly answer at the moment, we recommend to the Commission to maybe in some years to establish a PMM, maybe a recommendation proposal from the EFSA. But the decision to make such a PMM is by the Commission. This is, for my understanding, our work in this case. We can only propose if we expect or if we not clearly can decide at the moment to make such a proposal. But I don't know the further way how does it work.
Okay, thank you, Gerhard. Well, if post-market monitoring would be considered as a risk management requirement, it would clearly be to the Commission to decide whether there is a need or not, because they are the risk managers and the member states, of course. But it's now thinking about in what particular cases of GM crops or GM food feed can you anticipate post-market monitoring would be needed? Do you have any examples that you can think of? Great.
Well, I'm going to throw a very hypothetical one out. People have thought about making a GM product with reduced allergenicity. And if you did something like that, then probably there would have to be some kind of monitoring afterwards to make sure it had an impact. Did you indeed reduce the allergenicity of peanuts? And people have been working on that. And it's good to look at, well, maybe a mouse model might tell you something. It would give you a proof of concept sort of answer. There are other things you could do that would be more directed, which would be to take people who are known to be peanut allergic and challenge them. And that's a very good way and a much better way to estimate whether you would reduce allergenicity. But I could imagine some people, and I'm not saying this should be done, but I could imagine some people putting on a requirement that there would have to be some kind of monitoring over time to see, in fact, if you have a peanut that's nutritious and does it indeed hold up to be less allergenic. But that's just one idea.
Just a distinction to be made. So post-marketing surveillance, if it's merely it's still hard to do, is merely to see is the product being used the way you thought it being used and the amount you thought it being used by the people who you thought would use it. It's very easy to motivate that. It's going beyond that to say, is there a health consequence in the population? That's where I think things get enormously difficult. But motivating the first two questions, I think, is easy.
I think at that stage you might need to differentiate between post-market monitoring and post-market effectiveness monitoring. In case of nutritional enhanced crops where we would like to find and confirm the effect that you have claimed, very identical.
But this effectiveness goes on already. We do it for iodine, we do it for zinc, we do it for supplements, fortification. Those are already understood. You measure effectiveness, you want to make sure it works, you want to make sure you exceed the upper limit. You QC on the products, make sure they're made the right way. So this is all part and parcel. It's nothing to do with GM. It's just the nature of the product. So that may be the answer, is the nature of the product will define whether you would recommend post-market monitoring or not.
If Ashild.
Well, the main issue with post-market monitoring is generally to start with a baseline. And the baseline, for instance, for the environment is always moving because there's a lot of change of agricultural practices, and thus, for instance, in France, more and more farmers are using zero-tilling, and thus it is changing the biodiversity, it is changing a lot of things, and GMO will be only one part. So the question is how to establish a baseline. Is it necessary to establish a baseline? And then which kind of variation do we have to look for and to decide that it is significant? And in most of the cases we don't know. It's only when we have crises like a dioxin or any other mediator for pharmaceutical famous in France, that we are able to distinguish something happening. The question is to be able to distinguish very slight variation which may have an important impact. And that's an issue for everything.
Thank you, Ashild.
Just some general comments. There is a very close relationship between us human beings and food. And if someone else than yourself manipulated that food or changed that food, we are very skeptical. And I think maybe a post-market monitoring or some kind of market monitoring, with all the skepticism that is out there towards GMO, it would be good for the first products that were released on the market, that we had some kind of post-market monitoring to assure people that this is safe. Like it's obvious that most models that we're using, they are not human. And there are great differences between the models and human being. And for the skeptic people, it would be easier to argue for them that, well, we have done this investigation. It's costly, but maybe it would be a good thing to do.
Okay, very briefly,
Okay.
I would just answer that because we know that adverse event reporting works, if there had been an issue with all of the billions of tons of GM foods that were consumed, something would have showed up by now.
Okay,
That's a hypothesis.
Thank you, Gerhard.
I disagree that this is assuring for people.
Ashild, we are adding another dimension to here. It's that the kind of safety reassurance function, the potential function of post-marketing monitoring to be a safety reassurance in the eyes of the stakeholders and the public. So going beyond that, what perhaps certain experts would claim. But briefly,
Just very briefly, I've been to India 30 times over 10 years, and there's a huge shift in eating habits. And McDonald's is now there, Kentucky Fried Chicken is now there, they're becoming Americanized in their diets. There is some change in body composition, etc., but we're not running over to monitor and see what's going on. Is there more cardiovascular disease? And can we pin that on McDonald's, or can we pin that on other lifestyle changes or whatever? And I don't know, from the talk of Alan Kristal, I don't know that we could figure that out by some kind of post-market monitoring.
You could for a great deal of money in a long time. Yeah, I mean, all this is doable.
We're calling the numbers that you've presented to us, so I won't go into detail. Yes, well, what's clear, I think, from what we're discussing now, it's quite difficult to come with the ideas of post-market monitoring from the environmental side, and about the subtle changes that we are looking for on this side, and to use these ideas for food safety. As time is flying, so I'm sorry, I need to move on with that. And on my list, there's one challenging question left before we move to the forum. And that's essentially now what you consider, given your experience in post-market monitoring, and given also the insights you have got through these FP7 project, what would you consider as the remaining challenges and/or limitations to post-marketing monitoring, with a particular focus on food? And I would be glad if a few of you could comment on that before opening to the forum. Anyone would like?
Okay, can I go first?
Yes, please.
Okay, go first. And I say this, I wanted to get in first because we deal a lot with food companies and issues about traceability, and also knowing the commodity markets and how you get the things that go into food to the food companies. It's an exceedingly complex thing. And to try and monitor given events in commodity markets and figure out how that's going into the food supply system and what percentage is being exposed, et cetera, it is an undoable task unless you have it restricted to only one food. And to give a good example that shows you how difficult it is, kiwi fruit. Somebody was eating kiwi fruit earlier today, or maybe that was at the hotel. Kiwi fruit was introduced into the US, and it was almost 11 years before people realized that it was causing food allergy. And that is a clear, identifiable food product that nobody could mistake as to what is the thing that they're eating. And so it took 11 years to sort out, and it does have some fairly dominant allergens. But when you look at the food supply system for commodity crops and understanding events and how they will change over time and concentration, I think it would be the most challenging thing possible to try and sort exposure in any kind of health effect.
Thank you.
Yeah, maybe just, we touched on this yesterday as well. There was a question about maybe vets or veterinarians carrying out post-market monitoring on farms. Particularly in the case of pigs and poultry, I think it's that kind of thing is a non-runner with the commodities, as Rick said. These diets for these types of animals are formulated on a least-cost basis. So from week to week or month to month, you may have 20 ingredients available to you. You may have 7 or 8 of those ingredients in your diet. So you may have the ingredient in question in your diet today, but it's not in your diet tomorrow. So it's a very difficult situation to monitor.
Thank you for the comment. I think it might be naive to anticipate that post-market monitoring in the case of feed might be more easy, just because the animals are confined space and you know what you feed. But given what you said, that needs to be taken into consideration.
I think it would be very different.
So anyone else would like to comment on the remaining challenges or limitations for post-market monitoring? Touched upon a few already.
Money.
Yeah, I would clearly support Ashild. The main issue is long-term means available for monitoring. And just one of the questions is how to deal with that. Research projects are almost up to 5 years, and then you have to look for money, and probably you can start again on that. So it means we have to find new ways to detect unexpected effects. It is clear that our states, not only the European ones but also have less and less means to be made available. So it's why, for instance, in France we are considering the involvement through websites or etc. Of the citizens or in environmental associations, etc. And then after that we could retrieve the data. And the question is how to be able to distinguish the effect in terms of noise, which is very important in general, and to distinguish something happening. And just we need software after that, and people able to distinguish that something is happening.
Thank you, Yves. So Ashild brought up the issue of costs. So let's this be the last round before we open for the forum. So we heard in Al's presentation the number. You brought up the number of $27 million.
So we didn't even finish. So
not even finished for a case of Olestro. I think it was Sandy who reported from the audience that he, in the case of phytosterol, which was a kind of limited post-market monitoring related to use and consumption patterns, if I recall that correctly. They spent about 1 to 2 million British pounds on that. So these are the numbers that have been out there. So I'm just wondering who should bear the costs for post-market monitoring? Any ideas about that? Barry?
So in the Philippines, every 5 years by law, the government has to survey food intakes for huge numbers of people. It's the largest nutritional survey in the world, and it's done every 5 years, but only every 5 years because they can't afford to do it any more frequently than that. Other countries like Indonesia will do it every 10 or 12 years. Some countries never do it. So in those cases, the costs are borne by the government or a World Bank loan or something. But again, it's not targeted on a particular product. It is a form of surveillance because you want to know what the levels of adequacy and inadequacy are in the diets and shifts in dietary changes. But that's a public purse that pays for that.
Okay. Should we expect the developers to bear the costs?
Well, what I want to say is the reality is the consumer will pay. And when we think about what does it take to do post-market monitoring, you need a labeling system, you need segregation or tracking system, you need to have health professionals or whoever's measuring whatever they're measuring, and the consumer will pay. So I would hope that we would restrict PMM to something that really has very high value and payoff, and not go for general surveillance, because well, you know what? We didn't evolve to eat a very narrow diet that is unchangeable. We evolved to be able to eat a huge variety of foods. And so I think that most of the changes that will come about by genetic modification will be easily fit within the spectrum of what we evolved to eat. But that's just a philosophical thought, maybe.
Okay, with this I would like to open the discussion to the forum, so please feel free to engage in a discussion with the panelists. That's so in a way, I also get the impression that we seem to be overwhelmed with what might be required. But thinking of what's included in the guidance, yes, the guidance, and it had also been mentioned by some of the panelists, is that post-market monitoring might be required only in very specific cases, and what would actually would be a kind of what would be the content, what would be the it, as you call it. This would be determined in the particular case. For example, in Yves' document, there is one particular question listed in here that can be answered. Is the product used as predicted or recommended? This would be a valid question, and I would guess that this question, for example, with nutritional enhanced products, it might be answered. You might be able to afford to establish a post-market monitoring or MRO.
Straightforward, yeah.
Effectiveness.
It's the health outcome problem. As soon as you want to go from exposure, as soon as you want to go to exposure to health outcomes in human populations is when you really have a big problem. I think I sound like a broken record, but I said it over and over again.
Helmut. Thank you, Armin. And I fully understand also the intervention by Michelle before. I think we are now in the crucial stage of the discussion of this topic, I think. And I understand that I also have the same impression every now and then that this seems to be very overwhelming and difficult to cope with. And in such situations, I think we always need to structure any approach, some guidance, some criteria on the basis of which to decide. So I'm wondering if it would be, I would recommend in fact, with respect to the basic question, if and what and how to monitor, to develop a set of criteria which assists us in the collective decision on how to move forward, in order to avoid a situation where we seem to be trapped by, let's say, a situation which we think impossible to solve in a very important area, food, which is very personal to every one of us. And in this situation, I would just like to throw in a few thoughts. No solutions at all, not even suggestions for solutions. It's, I think, an important process which we are entering here. I would suggest that the important focus should be on the risk assessment. Monitoring should not be regarded as any instrument which, so to say, replaces an instrument where we have done risk assessment too fast or too quick or acknowledged that it's incomplete. I think the focus should be on the risk assessment. And if we decide on where to spend more time, money, etc., my suggestion would be to focus on the risk assessment. Now, that does not mean that we should forget monitoring. I think monitoring still remains an important complementary item. And here, I think we should enter into a discussion about criteria which help us to decide which and what to monitor. Science has an important role to play to provide input into this, but I would like to again make the point that the decision on if and how and what to monitor finally is not only a scientific decision. It's we as society as a whole which take this decision with different inputs from different sources. And we should also be able to speak out about this and not do as if monitoring is only a scientific question. It is not. And last point, the world is complex and it's getting complexer every day. And the products which we are dealing with, we are buying are getting more complex. I think we should also not be shy to embark on developing methods which also follow this complexity with instruments which allow us to trace and to track these every more complex products. So what I mean, I think we do not have the appropriate methods for monitoring yet, which are much more complex methods than we are applying for now, which would be appropriate also to follow the complexity of the products as such and the variety of products which we have available. So something as the omics in the genetic field or in the biological field, also in the monitoring field as some kind of mirror of what is happening.
You've probably already concluded. Okay. Yes, I know that Rick would like to comment on this. I just want to make sure that the audience has the opportunity to engage.
Ask a question. Make sure that we didn't put you to sleep by all of this talk.
I have another one.
Can I say something inflammatory just for fun?
Why not?
Please use the mic.
So omics is what the entire scientific community is sort of now proposing as a solution to every problem, right? It's omics. It's complicated. We're going to do omics. I just think that's nonsense. I don't think we're going to get anywhere with omics. We're not going to be able to track these complex things. We're not tracking them. And I hope we don't just think, oh yes, in the future we'll be able to do this and we have omics technology. Unlikely. We can argue that point, but...
Okay, thank you, Alan. Great.
Okay, so I'm trying to get back to real examples that would help us get there. And so I don't know all the details by any means, but what I do know is that there have been times, and I can't give you the details, of assumptions or indications that a certain mycotoxin in maize or in sorghum or in some other commodity crop leads to liver cancer. And people have tried to answer that. I mean, clearly that's not something that's easy to surveil, but they get some hints. And so then they start looking to see, well, okay, what's the exposure of certain mold types that make those mycotoxins? And then when we surveil 50,000 people, is there an increased incidence of liver cancer or testicular cancer or sterility? And people have looked, I mean, we can look through the literature and we can certainly find examples like that that probably should be evaluated further before we decide we can jump in and do some kind of an assessment based on a GM product, especially one that would be here now, that would warrant that kind of search. And again, it ends up having to be a hypothesis-driven thing, you know, and I don't think it's been that clear. Is the case of trans fatty acids that clear in terms of heart disease and things like that? I don't think it is. Some people maybe have better information and would. Those things are very, very difficult to do, and that's when there seems to be a link and something that is, you can put a hypothesis about, and then you have to test it in this horribly diverse human population with all kinds of environmental and genetic differences.
Thanks, Rick. So there's a hand being raised. Please, could you bring on a microphone to respond to that question? And please be very brief. Better.
Yeah. I suppose you can never say any food is 100% safe. That's the reality. But from our studies and from any of the studies that we're familiar with and are done by people that their work is respected, I would be assured that it is a safe product. And I would have no problem consuming it myself or my family consuming it.
Thank you, Peter. Anyone else would like to respond on these comment on the comments? Gerhard?
I would extend its answer. I think in all the GMs of the first generations was input rate. There's no substantial changes in the composition, no substantial changes in the exposure, in the index of man and animal. I think there isn't any need for real. We have, and I would underline, you mentioned it, we should focus on the risk assessment as intensively as possible, and we try to do it. The situation may a little bit change if we have GM plants of the second generation, the output rate, is also fatty acid better, or what else? And we have quite another situation for the exposure of the people, and probably this could be in the future, for our future, if we have such products, could be an example for BMM. This is my proposal, my conclusion from the whole discussion, because of the costs of the complex things, of all the things discussed here, but for the first generation, I think personally no other food is so intensively tested, analyzed, studied, composition and so on as GM. We shouldn't forget it.
Okay, Ashild, one more comment on ammonia 10, and then let's turn to you.
Well, that's not exactly for one, but a general comment. And I tend to agree with you, but still I have I wish that we could trace this in the future. So that we need labeling. We need labeling. So there are many that are against labeling, but I will argue for labeling so that we in the future can go back and see what happened. So to a greater extent than we will be, which is possible without labeling. Labeling of GM products.
If I may answer that, in a way it is labeled in the sense that all foods are labeled, and the fact that we can do tracebacks to figure out which spinach has E. coli 0157 and which foods have melamine and so forth. It's labeled by the food companies. You cannot put enough label space on the labels of a candy bar or a gallon of milk today to describe all of the possible genetic modifications and what's the percent and so forth. What we need it for is to give some nutritional help and help to allergists. The food producers have lots, they have records, and that's the system that is working pretty well right now for health purposes.
I know that the last intervention has triggered some more responses, more on a general level, but I really would like to close somehow on time. We would like to stop that general debate here and to try to pick up the question of Michelle for if you would like to respond to that, and then have the final round for concluding statements, and where you can, if you would like, can bring in your thoughts, please. Okay, Michelle. Who would like?
Oh, well, I had a $6 million grant to develop a handheld machine to measure diet, and I can tell you it's not going to help solve this problem at all. I mean, until we have this tricorder on Star Trek, does anyone remember this machine? It goes beep, 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 and it tells you the molecular structure of what you're looking at. Until we have such a device accurately measuring consumption of humans, free living humans of food, is really not that. It's always going to be difficult, and it's never going to be that accurate. And you can throw every computerized thought in the book at it, but when we have the tricorder, great. And I don't see that in my particular lifetime. So, and the other side is exposure. So that's exposure. And the outcomes, all right, so you can measure outcomes, and you can build machines that get increasingly complicated and increasingly small. But each time it's a specific outcome, it has its measurement error, it has its measurement bias, and it's one item. And so you can't measure everything. And you're still stuck with the problem of what endpoint you have a hypothesis for. Rebar doesn't have much measure. Shut up.
Thank you. And here's about beyond Star Trek.
I guess
as participative democracy,
I guess that it is like a representative democracy, participative democracy. People will be more and more involved in any system like participative science. At this moment, people are sharing the time of the computer for calculating something else. They are using smartphone for surveying the biodiversity, etc. And I guess that it is one of the trend of the future to the participation of citizens and consumers to any monitoring system.
Of course, it's also first world, because they're not going to expect people in Africa and India to walk around with their phones and all this high-tech stuff.
And there are also huge implications on
Really?
privacy and human subjects.
First world.
Huge.
it's more easy to implement them.
I know that this topic will deserve another round discussion, but I'm afraid that we really deserve cultivate. Therefore, I would like to ask the panel now for concluding statements. And please try to condense your statement to a few bullet points, if that would be possible. So, not each of you requested to do a statement, but anyone who would like to volunteer would be very welcome. Okay, Gerard.
Okay, may I?
Yeah, sorry.
So when I got the invitation to this, I said, of course we're going to do monitoring. You know, it's what we do. But we're going to do it in golden rice, but we're doing it on high zinc rice, high iron rice, high beta-carotene maize, high beta-carotene sweet potato. All except for the golden rice are non-transgenic. So it is nothing for us, in some domains, it has nothing to do with transgenic. You will do this, okay? But again, we know exactly what we're looking for. And there is one other point I want to make. From the discussion on the post-market monitoring, it seems like most of the examples tend to be in the environmental case, arena. Okay? And Yves here was very sympathetic to the fruit tree farmers in China who had lost their subsidized insect control that had been coming from the heavy pesticide use of cotton, and when it switched to BT cotton, they actually pick up their costs. But I want to give an example of the other direction. Before the introduction of virus-resistant papaya in Hawaii, conventional and organic papaya industries were going down the toilet. They were just ceasing to exist. With the introduction of virus-resistant papaya, transgenic in Hawaii, first of all, that part of the industry recovered gangbusters, but now the organic papaya industry has come back because the presence of the transgenic crop has so reduced the virus load in the environment that the organic producers are back in business. So it can go both ways.
As a former plant pathologist professor, it was an expectable effect.
Should I just, yeah. I think I'd like to join you in your comments. We need to develop better programs for surveillance, for post-market monitoring, and I think the EFSA, for example, is working on that. They have a new project on emerging risks, how to pick up emerging risks and how to deal with the results that are coming. So, work goes on, develops further.
Along the same lines, and quite briefly, I would like to say that I would not like to go out of this discussion with the impression that post-market monitoring, being it in the environment field or the food safety area, is just too complex, too difficult, and too costly to do. I think this is, it is an argument, and we have to take it into account, but I think it's not the whole part of the story. I would like to suggest that we spend time, energy, and ideas to develop meaningful, cost-effective designs and approaches to that. And the big advantage here, I think, is that environment and food area can learn from each other. They're different, yes, let's differentiate where necessary, but also let's try to combine where appropriate and learn from each other. And the big advantage here I see also in the area of general surveillance or general monitoring, however you call it, so the more difficult part of monitoring, is that with such an approach we lose a bit the track of focusing just on one technology and one type of organism, GMOs, because we do general surveillance, general monitoring, as the name says, in general terms. We find things happen in the environment. If we are able to backtrack it, fine. But we are getting a broader picture and looking about, for example, agricultural systems as a whole, and try to sort out what is right here and what is wrong, and which approach is sort of sustainable for the future.
Yeah, I did it already. Focus on the risk assessment in the case of the first generation plants, and afterwards, in the next years, we will have very interesting topics, very interesting GMO, like functional food. We should probably focus in this direction. This is a new challenge for us. This is my recommendation, to be realistic.
Okay, I guess what I would say you could almost imagine, except I would like to ask one question that I think is very important. I keep hearing that we should wait until the next generation. And I would say I think we need to define what that next generation is and what things are different enough to be treated differently, because just because in 2011 we say, this is the end, okay, everything else is next generation, that doesn't make sense, because the next thing will be something like 1.810. So that doesn't make sense. I think that the foods that are out there on the market today, there is no evidence that I'm aware of that suggests that there's any harm to animals or to humans, and it is, as to the appropriate standard for the FDA in the US anyway, it is as safe as the conventional food varieties that are out there on the market. And so I think that that is the standard we have to use and continue to use.
My concluding statement is, let's focus on robust pre-market assessment. It has served us well, and I think will continue to serve us well into the future. But for the people who are concerned about GM food, I'm just reminded of the fact that there's 300,000 different higher plants out there. 80,000 of them are edible. We are practicing GM on about 10. There's 79,990 other plants that you could eat if you need to avoid GM.
I have a similar type of statement to TJ's. I think, like, we all know that safety is of paramount importance, and our regulators should ensure that consumers and animals in the EU are safe and we're producing safe products. But that has to come through pre-market risk assessment, principally. And I would suggest that post-market monitoring should be an exception rather than the rule. It should only be in very definite circumstances that money should be wasted on post-market monitoring, only when it's justified. And I think probably adverse event reporting is probably where it should be concentrated on, or maybe to validate assumptions that are made during pre-market risk assessment, and possibly only those two situations.
Thanks, Pat.
Well, I agree with you 100%. The issue is there's no reason to go into, my opinion, there's no reason to do post-marketing surveillance unless you have a reason to do it. And in many cases, it's justifiable to understand how the food is adopted in the population, who's using it and how much. It's an interesting question. It's not hard to know. But when you make the jump to trying to evaluate the impact of disease in human populations, I think at that point you need to have a very valid hypothesis, and it needs to come out of the pre-market testing, and it has to be a question that can only be answered by using a population-level approach. And there aren't too many questions like that. I think most of the things you want to know are done through clinical trials.
Okay, thanks, Alan. Okay, well, thanks to the panel for the discussion. This was really great. Thanks to the audience and for engaging somehow and being patient with respect to the time. I think it was quite obvious that the panel did not manage to solve all the burning questions, but it helped to make visible the challenges that are out there for post-market monitoring if it's being put into practice in terms of food and feed. And it definitely helped to give you a kind of clue so that this will not be a kind of general and mandatory requirement for all GM food feeders out there. It would simply not be feasible. It would rather be something that will come into place in specific cases, perhaps with second generation of GM crops and food feed. Thank you very much.